And welcome back to Open. Daren Jaime here with you as we continue our coverage on coronavirus and how it's affecting New York City and particular districts. We're pleased to be joined by a very special guest right now who will share. She's actually coming to us live, and she is actually working in her district, delivering food. None other than council member of the 16th district, council member Vanessa Gibson. And good to have you.
Thank you. Good afternoon. It's good to be here. Sorry I can't see you in person, but that'll happen soon.
Yeah, well, it'll happen soon, and we're doing it virtually. But in the meantime, it's good to see you and good to be with you. Talk to us a little bit about this because you're out there having food distribution for the community. Talk about what you're doing right now.
So for the past couple of weeks, obviously dealing with this coronavirus and the fact that every day it seems like there are more positive cases, more hospitalizations, and unfortunately for us in the Bronx, more Bronx deaths. And it's really alarming. And as the council member of District 16 in the West Bronx, it's really been overwhelming to try to coordinate all of the services with multiple city agencies on the ground, making sure that our schools are open for grab and go breakfast and lunch for children and families, making sure that seniors are taken care of as it relates to home delivered meals and health and wellness checks, making sure that residents in public housing are good, working with housing authority and working with the mayor's office. It's been a lot of coordination. I've never been on more conference calls and video conferences in my life because
Right.
that's the way we have to talk. So it's every hour talking to commissioners, deputy mayors, the mayor's team, talking to the governor's team. You know, honestly, the reality that we have faced in the Bronx is access to food, healthcare, and testing. Testing sites have been coming online across the 5 boroughs to alleviate the overburden of hospitals, right? So looking at sites adding additional capacity like Jacob Javits, looking at New York Expo where you have additional hospital beds, right? Where you can take residents that are hospitalized with non-COVID cases out of the hospital so that the hospital staff can focus on those that are hospitalized with COVID-related illnesses. And then the other issue are the testing and assessment sites, looking at how we can use our H&H public hospitals, Jacoby, North Central, Lincoln. But in addition, for those of us in Highbridge and Morrisania, which we saw the DOHMH data just last week, the highest rate of hospitalizations are concentrated in areas of Morrisania and Highbridge. And we know that's for a reason. The underlying issues of heart disease, of diabetes, and asthma is real for us in the South Bronx. We've been dealing with this for decades. So we understand when our residents are hospitalized, your lungs are compromised when you have asthma. And so the reality is our people are dying. They're being hospitalized, but they are losing their lives to COVID-19. So yes, we want to talk about more assessment and testing sites because people that have symptoms are worried. They can't get tested and they're at home self-containing themselves, but we're discouraging them from going to the emergency room, but they still need help. So I've been saying to the administration, let's focus on our clinics, our local community-based healthcare centers that are already open and operating on limited hours, but there's a continuity of services. Our residents sometimes go to emergency rooms for emergencies, but they go to their local clinic for regular checkups. So we should be working with those medical professionals and coordinating services for them, getting the equipment, the personal protective equipment, the masks, the gowns, the gloves that they need, but allowing them to do some of these services so we reduce the burden on our hospitals.
Right. I want to get more specific because when you talk about communities of color, and that is a conversation that's being had, but not really being vocalized too much. We know that there in communities of color, the chronic diseases mostly occur in communities of color. Secondly, we also know that as you pointed out, the Bronx with the high rates of asthma, the high rates of these other diseases are actually right in your pocket. But yet and still, when it comes to testing, it doesn't seem like the testing sites are actually in good proximity. Can you share a little bit more about that? Because if I'm sick and I'm in your area, I mean, literally have to take a bus or some form of public transportation to get there. And if I'm correct, I think that puts more people at risk.
Right. And that's been the challenge. We've been coordinating with both the governor's office, who really oversees all of the drive-through sites, like we have at Jacoby Hospital. There's one at Lehman College in the parking lot. There's one up in Co-op City behind Bay Plaza Mall. Those are sites that were identified and coordinated and really overseen by the governor's office and his team. The city's testing and assessment sites are really at health and hospital locations. Those are public hospitals. But for us, the only public hospital we have is Lincoln, which is doing assessments and testing. Just today, we learned that is a new site for assessment and testing at the old Morrisania Diagnostic Treatment Center at 1225 Girard Avenue. That's between 167 and 168, between 8 a.m. and 4 p.m. They're doing it in shifts for the public as well as first responders, medical professionals that want to get tested. But I've been saying I appreciate that. Thank you very much, but it's not enough. What about Highbridge? What about a whole neighborhood on the hill west of Yankee Stadium that's isolated, that has nowhere to go? So we've been pushing. It's obviously the city and state that have to do this. So looking at some of our excess parking lots along the Harlem River by Mill Pond Park, right next to Yankee Stadium and the Major Deegan, there's a lot of parking over there, and no one's using it today. That's usually for fans that come to Yankee games. No one's using it. They're empty. And we ultimately could use those parking lots as a drive-through site, right? For anyone in the West Bronx that can get there. But I also think we have to pay attention to Highbridge, because the numbers are alarming. And we know that while we have documented cases, I'm more concerned about the cases that have not yet been documented. And because we don't have race and ethnicity, we know that this disproportionately impacts Black and brown communities at the highest level.
Yeah, we're seeing that in Chicago. We're seeing that in Michigan. We're seeing that actually across in several pockets around the United States. In the state of Chicago, city of Chicago alone, 70% of infections, or I should say deaths, are actually occurring in African American communities. So the numbers are, the numbers are alarming. Give me a little bit about Yankee Stadium and the Yankees. Have you had any conversation with them in terms of saying, listen, we need to use some of your area possibly, and seeing about that partnership?
Yeah, so we've been in conversations with the New York Yankees, and a lot of the excess parking lots along 153rd Street, along River Avenue, along the Harlem River are owned by Bronx Parking Management, which is a private entity that we've been working with around just accessing these parking spaces for local residents during the non-baseball season. So there are conversations happening. The challenge is that I think in the past with some of the drive-through sites, they have not been as successful as we want them to be. It's a lot of work. It's a lot of effort. And testing, as I understand, takes up a lot of personal protective equipment. There are certain regulations you have to follow. It's a lot of wear and tear on staff, right, for assessments and testing. There's a certain distance that you have to have with patients. So it is a lot, but I think it's important and it's warranted, because the reality is people are being hospitalized and they're dying. So I appreciate the president, the governor, the mayor, all talking about more ventilators and looking at excess sites for additional hospital beds. That's going to be a great thing, because people are hospitalized right now with non-COVID related illnesses, but they're in the same space as someone that has COVID. And that's dangerous and it's very risky for them, particularly in the Bronx. So there's going to be some more push. Elected officials from the state, my colleagues, Assemblymember Latoya Joyner, Michael Blake, Gustavo Rivera, Luis Sepulveda, Marco Serrano, we're all in communication, putting together letters, and we're going to do some pushing to the governor's office about drive-through sites, as well as the city on some of the city property that we own and we control, so we can get more testing, drive-through. But I also want to get our clinics and our healthcare centers involved too. I don't want to forget them.
I don't want to leave this interview without asking you this last question. Talk to me, because you've got healthcare sites, you've got hospitals that are in your district. Talk to us about, what are you hearing from frontline people as to the needs and the gravity of the situation right now?
It's a nightmare. I've talked to folks who work at Montefiore, at Barnabas, at Bronx Care. It's alarming when you hear about morgues being over crowded, when you hear about funeral directors that are working triple overtime, it's alarming. People are dying at such an alarming rate, and it's nothing that we've ever experienced before. I think people are filled with anxiety. They're frustrated. They're angry. They're depressed. It's a lot of wear and tear on your body, your mind, and your soul, that you have to wake up every day and do a job knowing that people are going to die. But I think New Yorkers are resilient. We have been through a lot of challenging times before, and we all know we're going to get through this. There are going to be some bumps in the road, right? I always say there's setbacks, but setbacks are preparation for a comeback. And people need to, adhere to social distancing. They need to stay indoors, only go out for essential services, because there are tons of people that are carrying the disease that don't know. And they may or may not have symptoms. And that's why we tell you to make sure, look, you have your mask, right? You have your gloves, because it's important. You are 6 feet away from someone. So I think people are anxious. They're nervous. They don't know when this is going to end. The idea that we can't go outside, we can't go to the local park, is frustrating. Children are in their homes every day, and it's a lot. Families are in their homes. I mean, we at the city council are looking at some of the other underlying issues that will result as a result of COVID, like domestic violence, right? Where you have, intimate partner violence. You have couples that are trapped in their homes, that have nowhere to go. They don't want to go to a shelter. They can't live on the street, but they're in a situation that's not safe for them. And they're more likely to not report right now. Those are the things that we're thinking of, because we know it exists, but it's hard to reach those households where people don't want to come forward. So I think when you talk to the medical professionals, the frontline staff, everyone is going to complain about lack of equipment and resources. They're going to talk about overcrowding emergency rooms, patient after patient, and the continuity of care is what's going to be lacking. Like, you are a patient, but I got to get finished with you so I can get to the next one and the next one and the next, and it's like that every single day in our hospitals. So we give a lot of credit. We sometimes think that all heroes wear capes, but I tell you, all of our heroes are wearing doctors' uniforms. They're wearing, police uniforms. They are nurses. They got scrubs on. They got gloves on. They're in the supermarkets. They're in our schools giving out food. These are our heroes and sheroes. And I think sometimes when we go through these challenges, you are reminded of some of the everyday heroes on the ground that are doing this work anyway without any recognition. And so we got to pray for them. We have to pray for their strength, because a lot of times we feel weak, like we want to give up, but there's too much at stake, too many people dying, and it can happen to anyone. This virus is not discriminating. It can affect any and every single one of us. So we have to understand, when we are giving guidelines, we have to follow them. We have to check in on neighbors and family, those that are medically frail, that may be homebound. I'm hearing about cases of seniors that were found dead in their apartments because nobody checked on them. Like, we can't have that. We've got to check on people that we normally don't hear from.
All righty. Well, we got to leave it there. Councilmember Vanessa Gibson of the Councilmember District 16. Thank you so much. As you're out there, stay safe. Continue to give us the information. We definitely want to follow that about the testing sites and seeing about what we can do about raising our awareness, raising the voice about getting those testing sites in more and better localities. Thanks so much.
Yes, we'll stay in contact. When we send letters out, we're working on a letter now, but we'll make sure you get copies of that. We got you.
Okay, then. Councilmember Vanessa Gibson, we leave it there. We got to take a quick break here on Open. We'll be right back right after this.